Today, we talk about...
There's one thing, and we can kind of maybe wrap it up after that. I want to, because how long have we been at him?
About hour 15.
God damn. All right. Well, we'll
We're
go for
having fun.
Yeah, we're having fun. We'll go for like another 10 minutes. That's cool. Sure.
Yeah.
We're all good with that? All right, cool. So what I wanted to ask you is, do you ever consider, you hear about this gene therapy that's becoming big now?
Yeah.
And it's obviously in the next 15, 20 years, they're saying that we can manipulate genes to do this and that.
Right.
Do you ever, not even worry, but I guess on one hand worry, on the other hand, does it interest you, the things you'd be able to do with manipulating the human body aesthetically, not just, because they're talking about it for health reasons, but there's also going to be aesthetic reasons. You could change eye color or change, the amount of protein synthesis naturally that your body can do because blah, blah, blah. Do you ever think like, oh, because I'm in cosmetic surgery, if there's not a need to physically get in there, that's going to kind of go away? Or you think it's so far away that doesn't even concern you?
It's so far away. I mean, there's things, first of all...
Watch it debut tomorrow now.
No. First of all, stem cells. Everything's about stem cells.
Right.
And you can... actually, believe it or not, fat has the best stem cells ever.
Uh-huh.
You can put fat, you can again, spin it down, or blood, spin it down, put it in under your eyelid skin to get rid of dark circles. You can inject it into your scalp to grow hair. You can but I think to change a genome, go in there and surgically remove, if you want a blonde-haired, blue-eyed baby, I don't know if you can actually do that.
You don't think we're going to get there in like 20 years?
Who the hell knows?
Right, who knows?
I think once the fertilized egg is done, I think the genome is there. Can you cut it out? Unless you get it at its one cell creature type of a thing. But once it becomes its blastocyst and zingocyst and 4, 6, 8, whatever, it's already it's in you, and I don't know how you can change that. Unless you go in there and get the egg and change the egg and get that one sperm and change the sperm and then put it into a petri dish, I don't know really.
Well, my guess is that they're going to just basically manipulate the machinery. So all the mitochondria, all the genes that are turned on to produce X, they'll just flip the switches of the genes or infuse whatever stem cells that have the different genes activated for the different eye color or whatever. So I could see that maybe, but yeah, it's just it seems so far away. But next thing you know, it's going to be here. I don't know.
Right.
It's like when I was discussing with you about like machines taking over and doing your job for you. You're like, go fuck yourself. But you also didn't think that was going to be the case.
I think before then, there's going to be a pill for this, a pill for that, an injection for that, an immunization for that. Right. There's going to be an immunization for fat people. There's going to be, I mean, that's politically wrong. You can't for fat. There's going to be more, therapies by immunizations to prevent such things.
I feel like, but what about like home lipo kits? It just looks, and no offense to what you do or what plastic surgeons do, but
we get it. We'll have them send you something. Actually.
I was gonna say, but like when you guys go in there,
I sell some online. The Hoover lipo section at 2,000.
So you can buy it on his website. I'm kidding.
Yeah, no, you can. Yeah,
but
$4,995.
You make it look so fun though. It's just like I'm like, oh, I could do that. All I got to do is go like that, and it comes out.
I mean, let's talk about the mental, my sickness of being able to cut somebody open and suck fat and grab a gland and I mean it
goes back It goes back and the way you say that, by the way.
I mean that's sick.
It's gonna give me nightmares. But it's true though. It's the idea that. But
Darren, can you take a hollow tube, and stick it in someone's chest and suck out fat? Maybe.
If he said yes, then we have to get him looked at by the FBI or something. I don't know. But here's the thing. But we were talking about that earlier.
I mean, it takes a little egomaniac to be able to say, "Oh, I'm gonna fucking suck the fat out of you."
Yeah, quit bragging.
Yeah.
But do you feel that way though? Like for you, because we were talking about getting grossed out. You say you're not really grossed out by stuff like that, obviously, because you do it. So, like, doing that, do you look forward to that? You're like, oh,
I do.
Cut someone,
I wake up in the morning saying,
I'm going to cut somebody open.
I'm going to, look at, when I may have an orgasm if I get out like 4 liters of somebody rather than, I got 4 fucking liters of fat out of you. It's
stimulating.
It's stimulating.
I have the opposite approach. Like, I just go to work. I literally just treat it like work. I'm like, all right, this is my job. This is what I do.
Yeah.
So I'm kind of immune now to the kinds of things I see. Occasionally, you'll see something out of the ordinary, but even the out of the ordinary stuff, I'll just be like, okay, yeah, this is my job. This is what I do.
You think it's because there's not a creative aspect to what you do? Whereas
I think that, and like I said, my fucked up brain, I just don't process things.
I mean, when's the last time you pulled a gerbil out of someone's backside?
Never. Never. Yeah.
He hasn't got.
Maybe for that I'll have an orgasm.
He did pull out razor blades. Did you pull out razor blades from somebody?
Yeah, I pulled out a razor blade, and actually
a razor blade.
Yeah. So what prisoners will typically do is they'll swallow a razor blade, or they'll take a paper clip and they'll tape it, and then they'll swallow it so that A, they don't hurt themselves, but B, they get a little free vacation out of jail and some drugs and then some fresh air and go home.
God.
So I had a girl come in. Right as I'm leaving for the day, of course, this girl came in who had swallowed staples. And so I had to deal with that. And then as soon as I'm getting ready to leave again, this prisoner comes in with the razor blade. So that's kind of like my day. And I remember coming in here because same way we started this, he goes, oh, so what have you been up to?
Right.
And I was just like, oh, yeah, well, I did this. And he's like, whoa, wait, what? Like, we got to talk about this. So I don't even... I don't know. I'm just
like, yeah, there's this little thing. Some guy swallowed staples. I'm like, the most interesting thing that happened to me is I made a guy do a crunch. You know, like you win that contest. But it's interesting that both of you guys, like your daily jobs, are. I mean, it's crazy. It's like you see some really crazy shit. Like you're opening people up and you're seeing people swallow razor blades. You know, but with you, Doc, what you're doing is. There's a creative aspect to it, right? So when you're looking at somebody, you're not just like, oh, this has to come out because it has to come out. You're like, I have to shape somebody to make them look aesthetic.
I mean, there's a good reason why maybe I like male bodies. You know, who knows?
Well, that was another question I had.
You know, I don't know, no homo, but
listen, we don't judge here.
We don't judge here. Yeah. But I mean, I think a nice pec, a good arm, a good is sexy.
Yeah,
you know,
there is something about admiring a male body without being even sexual. Because people always said, like, you know, Jordan, you like bodybuilding because you're closeted gay. And I said, I'm closeted gay. It has nothing to do with the fact I like bodybuilding. No, I'm kidding. But it's not about that. It's just like you could identify. It's more about like I want that on me. So like I know. Right. It's almost like when you're watching.
You just hit it. That I want that on me.
Right.
And I mean, you know, some of the best baseball players and coaches and batting coaches never played baseball. They're they're just hired because they're good, you know, batting coaches.
I can even break it down to you more basically. When I'm watching any game, it's like I want to fuck that guy. It's like no, I wish I can play as well as he's playing.
Right. No, you're right.
You know? So it's kind of like that with bodybuilding, or even admiring like somebody who's looks, you know, aesthetic. You're like, okay, that looks pretty damn cool. Like I wish I kind of had that kind of thing.
So if I'm sculpting a guy's, you know, lateral pecs down to his lats, you know, his pectoralis major muscle.
By the way, I just love his stare because he's looking at me like, you're a fucking closet, aren't you?
No. I just, but
no.
Okay. This is why you went into your field and I went into mine.
You know, and you're sculpting that nice pectoralis major muscle and that hockey stick boomerang shape.
Yeah.
And you're getting that you know, to the lats in the back there. You know, I mean, that's hot.
It's cool, no? Like you feel like when you see that stuff, because you have one of the few jobs where you see instant results. Like you're literally, you can make somebody in.
I mean, there's friends of mine in Brazil and in you know a lot of guys in South America and in Colombia. I mean, they'll take this woman and make the teeniest waist on them, and then inject liters of fat in each buttock, and then post-op, it's like Mount Vesuvius or whatever. I mean, it's got it's that peach, the thing of the peach. I mean, they look freaking awesome. These women, the teeniest little waists and these big butts. I mean, Kim Kardashian. I'm
she's
sure
all natural. Come on.
Yeah, absolutely, absolutely. I mean, her butt. I mean, she probably goes into hiding every 6 months and get some fat injected into her butt.
It's amazing how many people who get surgery get like more than one. You know what I'm saying? Like, and do you notice that in your practice? Because men are maybe a little bit different than women when it comes to surgeries. But do you notice, and not for the same surgery, obviously, but do you notice a lot of people coming back for, Doc, I want this done?
Yeah, no. So I do the chest, and they come back, and more often now they want the lower abdomen, the flanks, and the back done. They want a soccer butt. They want, you know.
Do you do rhinoplasties or not really?
Not anymore.
Okay. So you wanted to specialize in what you specialize?
I just don't want to do that.
Right.
Just, you know, I don't do them enough. If I don't do them enough, if I don't do one a week, one a day, you know, I don't want to do it. I want to be.
No, it's good of you. I can imagine there's some guys that's like, yeah, it's like I'll do anything.
No,
sure.
no, I don't want to do.
No, he's right because as a doctor, like you're only good at what you practice. So you want to be good, so you want to do.
You want to
that
just
thing.
do it every day. You want to do it in your sleep.
Right. And like you were saying before, it's about repetition in medicine.
It literally
so,
is, man.
right.
That's all it is.
It's what it is. But to take out of this is, something, if people are unhappy with what they look like in this day and age of social media and selfies and YouTube and Instagram. I mean, you go on Instagram, you go YouTube, everybody's a YouTube star now.
Right.
And everybody's doing a little Instagram of them at bars and dancing on the floor or walking down the street.
Right.
Everything is visual, and people, if they're not unhappy and they want something done, well, something, do it. Don't don't cheapen out too. Don't say, oh, I mean, sometimes you get this work done. It's life changing.
Right.
It is life changing.
But basically, you're saying if you're making the decision to do it, it's not something you want to get on a discount because it's pretty serious when you go into surgery. And there was a crazy YouTube video I saw, and I'll make it real quick because we'll wrap things up. But I wish I could remember, and I would pull it up. It was probably from 10 years ago, and it was about a bunch of botched plastic surgeries from people who didn't even have degrees,
Right.
And people wanted to get a discount on their surgery, and you just see this one guy got calf implants from this just underground surgeon who worked out of a basement, and it got infected and had to cut his legs off, and you're thinking you saved $1,000, but you lost your legs, and it's like heartbreaking because these people clearly want to get this stuff done, but they're trying to cut corners, and I'm like, why would you do that? You've already made the decision to do it, right? To go into the knife. Now you're going to go to someone who's not even qualified to be doing this shit.
Well, there's this hang-up called monies.
Then don't do it. Then just don't do it. You know what? You can save 100% of your money, and not. But I understand the mentality, but I also holy shit. It's like if you're already going to do something, it's not like buying sneakers because I know you can relate. But I can buy a shit pair of sneakers. They're still going to get me down the block.
But they're still going to look like shit.
They're going to look like shit. But guess what? I can take them off and throw them in the garbage. Yeah. You get a shit plastic surgery, you can get infections. You can get well, why am I telling you? You know this.
No. You're right. And also you got to go to a doctor who stands by his work. If you're not happy, they goes, something. Let me make you happy. How good? Now, if you've got body dysmorphic disorder, and says, oh, I'm do this, then after a while. But those pretty much show up after you've had 2 surgeries or 3 surgeries. It's still not happy on that. And you got to go to somebody else that just doesn't overdo it. Right. Some people just do it because they'll do the lipo, and they'll do a nipple lift, and they'll do fat grafting or a pec implant or this and that. Sometimes it looks or they'll etch the belly and you look like a Ninja Turtle. You got to be careful. You got to do it subtle and nice and not overdone.
You must have it must be a very difficult challenge because there are probably people, like we were discussing before, that are a little, I wouldn't say mental, but they have body.
Every once in a while, I'll get somebody who
body dysmorphia, and they're like, Doc, we've done this 4 times, and you're like, I got to be honest, God couldn't make this more perfect, but in their brain somehow. So what do you? I mean, because
you can't piss them off,
right? That's what I'm saying. Because if you
piss them off, they're going to go on Yelp and
right.
say, "Oh, this doctor sucks."
Right.
And that. So I mean, it's
you got to be very sensitive to them.
You got to be sensitive to them and say, "Listen, I could do this, but you may have this. I can do this." And you try to do it, and even if you do a little touch up, a little this, it may be help. But sometimes they're going to go back and back and back, and that's when you start to get their family involved and say, "Listen, we're getting a little crazy here. Let's speak with your wife or your mother or your or your brother
of what's going on."
Yeah, and get some perspective and see, is it only me? Is it you?
Can you save surgeries, so to speak? So someone that comes in, you're like, oh my God, those lips are awful. Whoever did that really fucked up. Can you take any plastic surgery that's been done and correct it, or are some things just one and done? If you mess it up?
If you mess it up, like gyno, if you mess it up, if you cause an indentation or a gouging and you have this crater deformity, you're in trouble. Okay. It's very tough.
What causes that? Is it taking
too much out?
So
over-resecting.
So you do leave some tissue in when you take it out, or no?
You take out the gland, but you want to contour the fat. So a major thing, let's say, is if somebody weighs 200 pounds or 210, and they really need lipo and gland, but they say, Doc, I really want to spend the money, or I don't want lipo, just take out the gland, and you kind of acquiesce to their wishes, and you take out. Sometimes if you do the right operation on the right person, you'll never fail.
Interesting.
That's about it.
Before we go, I want you to take a look at my nipples. Is that okay?
Sure.
All right. And can you like feel them and see if you feel anything in them?
I mean, can we have like Howard Stern here with the?
You're probably like, I wish it was a hotter chick than you.
I know.
But listen, you decided to work with men, and this is what you get. All right.
Right. I mean.
So, and keep in mind, I used to be fat, and you can't offend me. You really can. I'm going to be really pissed off later. I have this over here. So.
Yeah. So that is, I mean, that's just gland.
That's gland. So can you feel it?
So the nipple is.
It's okay, you can touch me.
You may touch it?
Touch it, please.
You know.
Are
you erect? Is it,
by the way,
nipple erect?
I might be able to get some fluid coming in.
No, don't.
Look.
No! Oh, that's disgusting.
I grossed him out. Oh, this guy cuts this out for a living. I grossed him out.
He's a fraud.
You saw it though, right?
Can I have a tissue? No, it's.
So you saw that, right? It's literally, it was leaking.
I don't know. No, don't squeeze.
Doc, it doesn't project. So I love that I just grossed him out. He's like, yeah, I watch these surgeries of penises getting cut in half, and then I just take my nipple. I was like, no, listen. So with that, so you would just cut that out and
yeah, lift up here. So what one thing you do is you want to see if you got fat or gland is if you have a nice shape to the pectoralis major muscle. When you make a muscle, you just have puff titties. They call them puff titties.
Right. Puff daddy. Yeah.
Puff daddy.
Right.
And you can get in there and you can grab it.
Yeah.
Well, that's a little gland there. Now that's gland. See,
wow.
I can get under the meats, the Arby's meats.
Did you bring your scalpel?
On that. So obviously, and then you got to see if you're fat and you lost weight. Are your nipples lower than the pec?
Well, I was going to ask you because it's been years.
I mean, everybody can go at home and your nipples to your suprasternal notch, that little notch above your neck, from the neck notch to the nipple should be 21 centimeters. It's a perfect triangle. 21 centimeters, and then is that isosceles or a perfect?
Yes.
What's a
isosceles
three
triangle, right?
Is a three
the
equal
three
sides?
same angles?
Yeah,
I believe so. I'll have to double check.
I didn't graduate elementary school.
Right.
Is it isosceles or it's not a right angle?
Yeah, I'm forgetting the other term for it. It's not obtuse.
Not obtuse. I think it's isosceles.
Yeah.
I think so. It should be 21 centimeters. So 21 centimeters from the suprasternal notch to each nipple, and then from each nipple should be 21.
So would there be skin removal here too, or just gland?
Just gland.
Oh, so I wouldn't have to worry about you cutting the skin off and pulling it, like stretching it down.
No, I mean if somebody's low and this and that, we can do a nipple lift. There's some drawbacks on that.
But it would go back. So it would technically go back to where it should be.
It should be higher, and I use quilting stitches. Okay. So I actually take the skin of the nipple and actually jack it to the pectoralis major muscle to kind of lift it up a little bit.
Do you ever have any idea before you take it out how big it's going to be, or is it always a surprise to you?
It's always a surprise. You kind of never know. It's like a box of chocolate.
You never know what you're going to. That should be in a movie or something.
It does. I think it is. I should put that in there.
I think he's hinting at taking that tissue home and eating it.
Yeah. Actually, we do gland in hand where the patients touch their glands.
I've seen that video. That was the video that was like, holy shit.
We do.
He has this. Have you seen this? So basically, after the surgery's done, the glands are on the table, and there was one video. So you made your patient.
The guy's cut him.
He's cutting it in half, and it's like rubbery and stuff. And they're pretty big. And what's funny is
I've actually dared somebody to eat their own glands, and I'll refund the money. I've actually nobody,
Oh my god. All right, so if I grossed you up with that little drop of
if I take your glands out and you eat it, the surgery you got to eat it though.
These glands.
It's got to be like in Fear Factor. You got to eat the
these glands produce milk. I'm not touching these. I'm not drinking my own breast milk. But this has been happening. So this actually, people think like, oh, he must be taking a lot of shit. I feel like this has been happening when I was a heavy kid. I had water. I mean, like it was almost like water. It's clear. Sometimes it's like brown and this and that. I've had MRIs and stuff. It's not from tumors or anything like that.
No.
So it's clearly just the tissue itself.
Just the tissue itself.
And what's funny is, and you might hear this too, depending on what I eat diet-wise or this or that or alcohol, it will affect that, and sometimes, and it shrinks and grows. So in other words, I've had it where it's very small, not noticeable. I've had it where it's large to the point where even wearing this shirt, you'd be like, holy shit, like what is going on, Jordan? So you can shrink it for sure, but it's always going to be there unless you get it cut out.
It's gonna once it's there, you can't. Maybe if you take an aromatase, it's painful. It'll lessen the pain. Some people say I can't lay on my stomach, I can't touch it, I can't run. If that hurts and you don't care about the mass, if it hurts, then take an estrogen, in a blocker, and the discomfort will go away. But the mass won't. The mass won't.
That just has to get cut out if that's what they want.
Get rid of as I say, get rid of the tissue, get rid of the issue.
That's it. What do you do with the? By the way, one last thing. I've always wondered this with all surgeons, but what do you do with that shit after you're done? Do you just like put it in a freezer or something?
No,
like,
the local Chinese food.
I was gonna say, like, do you just cook with that?
Broccoli, and they'll. It
looks like
little stir-fried broccoli.
It's an extra stream of revenue, right?
Yeah.
It's so you can make chewing gum out of it. It seems so rubbery and stuff. The breast tissue.
Yeah. I mean,
do you just save that, put it into women? Like, how does that work? Does it get recycled? Like, what happens? Or
medical waste.
They dispose what really? So, medical waste.
They got dedicated bins for that.
And they just burn it. Like, what do they incinerate it?
I don't know what they do with it.
Staten Island.
They're definitely using that to like clone us. I do not trust those motherfuckers. They are cloning.
They go
us.
to Staten Island.
Yeah, it mutates into fucking other beings and stuff. I don't know. I do not trust them with my body parts just flying around. Anyway. I don't know.
Right, I guess you're not getting the surgery.
I guess not. Well, not today. He didn't bring a scalpel. I thought he was going to bring a scalpel. We're going to perform it on the bed over here.
Just move the microphones.
Yeah.
We got some alcohol out there.
Doc, you want to get some views? Do that. We'll do it in the studio. Anyway, it was, dude, it was so cool.
It was cool.
I mean, you came to see us.
Yeah, thanks for coming.
Hour and a half?
Yeah, like hour and 40 almost.
I mean, should we talk about anything else? I mean,
you got anything else on your mind?
Yeah.
No. Everything's.
I think we covered it all.
It was kind of fun.
Yeah, and we talked about a little bit of everything here.
Yeah, why don't you tell us where we can find you?
Yeah.
Oh, so I'm Dr. Jonathan Leibowitz, and I specialize in gynecomastia, and I'm in Long Island, New York, Huntington, Long Island, New York, and I get people from literally all over the place. I mean, I get people from the Arab countries. I mean, a lot. I just operated on somebody from Dubai. I get UK a lot, Canada a lot. Because in Canada and UK, believe it or not, Jordan, they just want to liposuction this thing out. They think they can treat it,
it's bullshit,
or they'll take like one of those orthopedic raspers where they take like cartilage out and think they can do it. No, you've got to just cut it out.
Right.
And you got to make that nipple incision and cut it out. So my office phone number is 631-424-0101. You can email me at jonathanleibowitzmd@gmail.com. My Instagram and YouTube channel is both at Dr. Leibowitz, DrLeibowitz. What am I missing?
YouTube? You just said YouTube already?
Yep.
Same.
YouTube is Dr. Leibowitz, Dr. Leibowitz.
Watch him on YouTube, guys. Like that's how I found him.
I mean, it's fun.
He posts a lot of, and even if you're not like, even if you don't have gyno, like just to watch it, if you're just like crazy about watching that shit, like it's fascinating to see him work with people and just literally they're up while you do this.
Right, no,
and you pull it out and it's
they drive themselves home or they take Uber back to the hotel. It's kind of fun.
It's a fascinating thing for especially people who don't know a lot about it. It's just to watch if you're kind of a science nerd or something like that. And then if you do have gyno, I mean, I would say give him a call because he's one of these guys who's all over social media and stuff like that. And dude, I really appreciate you coming out here. To talk to us,
there's you can get gyno done by anybody else, but
don't though.
But
come on, I'm trying to sell you here, Doc.
No, but you know how many people say, "Oh, Doc, I'm 3 weeks out and it looks like my gyno's back." I go, "Well, what are you bothering me for? Go back to your doctor."
Right.
You know, but do it right. Do it the first time. You need the technology and you need the experience.
Right. And go to a doctor who's actually willing to do it himself. He's literally going to. He's going. I'm going to
be doing it. And you know something? I'm going to film mine. I'm going to be
do it.
I'm going to be absolutely filming mine and putting it on YouTube.
I really think, in all seriousness, I think that's brilliant that you're going to do that because that'll promote you a lot more. Because how many plastic surgeons film their own surgery? I don't know a lot.
Yeah.
So that's awesome. And again, thanks for coming out, man. This was a lot of fun.
Thank you.
Thank you.
All right, cool.
Thank you.
All right, bye-bye.